particular reason for that? I mean, if they're in the care system, I would think that this is something that should happen.
Yeah, you would think so. I think there are probably a number of factors, and this multi-year effort that the American Diabetes Association is leading around eye health, called Focus on Diabetes, is trying to tackle exactly this. So some of it is people with diabetes don't necessarily understand the importance of it. They might think, my vision's fine and I have no problem, or I got checked for glasses and my glasses prescription didn't change, but they didn't look into the back of my eye. Well, that doesn't count. So they're patient-related things, and then they're provider and system challenges. So one thing that has really been very helpful is the ability to take retinal photographs, and that technology really sort of increases the chances. You could imagine a retinal camera at a primary care office to be able to screen people right then and there. It's just, otherwise it's one more appointment to one more healthcare provider located somewhere else, and people are busy and things don't always work out as they should.
And what is the penetration of the retinal cameras into the healthcare system or primary care offices? Is this still a rare bird, or is it becoming, something that people are investing in?
Yeah, it's a good question. I would say in primary care, it's probably more a rare bird. Amongst ophthalmologists, it's probably quite common, and endocrinologists somewhere in between.
And does the American Diabetes Association have a policy or a recommendation on who should do these exams and who should have these cameras? Or is it the message that this is open to any number of healthcare professionals to do?
Well, optometrists and ophthalmologists, and one thing that, honestly, I was a bit surprised is that 80% of eye exams are by optometrists. And so that's where people get their eyes checked. Ophthalmologists can do much more, particularly when disease is identified. I think the key is getting screened, and then based on whatever disease might be present, then of course seeing an ophthalmologist that can treat that disease.
And just to be clear, in terms of these annual checks, we are talking about people with a diagnosis of diabetes, correct?
Correct.
What about the, I think the number of people with pre-diabetes is quite large. Do these guidelines from the American Diabetes Association apply to them?
Well, what we know about people with prediabetes, probably the most important thing is that they are at increased risk for diabetes. Most people with prediabetes don't even know they have prediabetes. And so it's critical that they get screened for diabetes itself. And there's a simple 60-second risk test on the American Diabetes Association website that people can take to see what their risk is to be diagnosed if they in fact do have diabetes, which, unfortunately, about a quarter of people with diabetes don't know they have it.
So the guidelines really apply to those with a diagnosis, and we are not talking about maybe a routine eye exams are good for other reasons, but in terms of the reason related to diabetes and vision care, we're talking about people with the diagnosis, making sure they get an annual check.
Yes, the value is most assuredly clearest in people with diabetes. There have been some reports of people with pre-diabetes having some eye disease, and that actually came out first in the diabetes prevention program, where they were looking to take people with prediabetes and see if they could prevent diabetes. And in fact, they discovered some people with prediabetes developed eye disease. So that's an evolving area. But we were very sure that people with diabetes should get a yearly eye exam.
And has this been a recommendation for some time, and you're sort of embarking on a public health messaging effort, or are these new guidelines that you are now talking about?
Yeah, it's a good question, Peter. Sadly, these have been for a yearly eye exam for people with diabetes has been for years and years.
Yeah.
And the numbers have improved slightly, but not greatly. So this is really an effort by the American Diabetes Association with our partners to tackle this. So, we need to do better, especially if it's the leading cause of blindness for working age adults, and it's largely preventable.
Nothing happens in medicine unless it's paid for. So is one of the impediments to people getting eye exam, has there been some reluctance or friction on the part of the payers, be it public or private, to cover these eye exams, or is that not really the issue? I'm just wondering, perhaps people are seeing some cost or concerned about cost.
Yeah, I would say there's definitely friction. It's not simple, and it's not always clear to the individual with diabetes that this will be covered. I think, as you well know, the payment system is complex. So yes, it could be a covered benefit, but one has a large deductible, for example, that has to be fulfilled. And the trend over the last several years have been employers are increasingly offering high deductible plans. So net result is, for the person living with diabetes, yes, there could be a cost barrier, and that really makes no sense when you think of the incredible costs associated with blindness to society. I
think the high deductible approach to controlling healthcare costs is fraught with problems and
yes,
open to debate.